Welcome to our podcast where we dive into the stories of trailblazers who redefine success and leadership in their respective fields. Today, we have an extraordinary guest, Dr. Prithvi, a pioneering gastroenterologist and an advanced endoscopist who has broken barriers in a male-dominated field. From becoming the first woman in Karnataka to achieve a DM in gastroenterology, to receiving prestigious accolades. Her journey is such an inspiration. But beyond the credentials, she's also a mentor, a philanthropist, an advanced advocate for women in healthcare. Today, we'll explore her inspiring journey, the challenges, triumphs, as well as the impact she continues to make. Dr. Prithvi, it's such an honor to have you on the show. Welcome.
Thank you. Thank you very much.
Let's start at the beginning. Your journey into medicine. Was this always the dream? Please tell us about your early years of your career, the influences that shaped you, and the moment you knew gastroenterology was your calling.
So, yes, talking about medical and gastroenterology, there were two different things that actually made me get into. Initially, after 12th, of course, you don't have much of an exposure to gastroenterology, so that wasn't even in the list. So, when I got into medical, yes, I had a passion for helping people, and I had a passion for this field particularly because I wanted to get involved in my job, as in, I shouldn't feel like it's a job. You're making a difference at a personal level. And that ways I had seen right from three generations of doctors, fortunately, in my family, and I knew this was it since the beginning. And once I got into medicine, that is when I started exploring different specialities. As we went forward with 5 years of medicine, I was not sure what subspecialty I need to get into. And that's when I took up internal medicine, which covers all the organs, all the specialties, including you look into diabetes, hypertension, and a patient as a whole. And 3 years of through my MD is when I realized the responsibility of the gut in the entire health. Well, that started becoming my focus. And what was more exciting was this endoscopy, these high advanced procedures that are very few specialists who are doing it, and very few centers that are doing it. And then I started looking into why there are very few specialists, why there are no female gastroenterologists in Karnataka. And then that is how it started. And then I started visiting these endoscopy units as a postgraduate, and then I got into internal medicine as a lecturer, and then explored the field further, and I knew this was it. The gut and the endoscopy and the advanced procedures, this was my calling.
Wonderful. So, gastroenterology and particularly advanced endoscopy is largely dominated by male. What were the biggest challenges you faced stepping into this space, and how did you navigate? How did you navigate all these challenges?
Well, first of all, as a woman, I realized why it was so. It was not just in gastroenterology. Well, gastroenterology was the upcoming field. There was not much exposure, but also in cardiology, also in neurosurgery, there were very few females, and that was because, at least in India, we had to finish 5.5 years of undergraduation and then 3 years of post graduation, totally about 9 years, and in between for preparation for the MD, let's take it a decade. And after that is when you get into something like a super specialty, be it gastroenterology or a cardiothoracic surgery, and that's where our biological clock comes in parallel with it as a woman, right? So when we are in our late 20s, and that is when we need to start our families, as in give birth to a child, and those responsibilities come in parallel to this kind of period where you're supposed to get into super specialty. Probably that is one of the reasons there has been studies why super specialty is not very sought out by women, and it was also one of the reasons quoted by those studies. Probably so, and rightfully so. Not everybody has the support to get into, and even though they are much smarter and they have all the enthusiasm to do it, unfortunately they will be responsible for raising the kid all by themselves, and parallelly probably it would not be practically doable. That is one thing. And second, gastroenterology is a procedure oriented field. Until and unless you are skillful and you want to take up something with the procedures and you are ready to take overnight call when there is a bleed or something which requires immediate care, and you are not 24 hours on the call and you're not ready to do it for the rest of your life, you cannot step into this. And advanced procedures can take about 1 hour at a time, 2 hours standing in OR. You should have that stamina as well. So, multiple factors which I started figuring out that yes, that is what that is what makes a woman to take a step back for super specialty. Otherwise, I'm sure, there are plenty of women out there who are much smarter than me, who could have probably done better than me, and who could unfortunately not get into gastroenterology.
Yes. So you're a very humble speaker. But speaking about challenges, balancing a demanding career with a personal life is never easy. So let's talk about how you make it all work. You're a super specialist, a keynote speaker, a mentor, and a mother. How do you juggle it all? What does balance look like in your world? And what sacrifices have you had to make along the way?
Well, I don't want to call it as a sacrifice. More than me, my children have sacrificed, I should say. Because when they come back from school to the house, I'm not there to hug them every day and ask them how the day was. They have to wait for me to get back to them and then talk to me about how their day was, which is very unlikely to my childhood. And I feel like they are giving up on so many things because of what I am doing. So I would say that as a sacrifice. Mine, I am doing my job. I am trying to juggle between these two, trying to do my best, and at the same time, having these everything that you mentioned, mentor, keynote speaker. This is my passion. These adds on to my energy, I should say, rather than thinking about it like taking off my time. I would want to say that, in fact, which is the truth, which gives me more energy to make every day better than yesterday. Where at least when it comes to work, and when you were talking about how do I balance it, well, it's never the same. Yesterday is very different for today, and it is a roller coaster ride. If I say otherwise, I would be lying. The thing is, I'm guilty of a lot of things. I haven't been, able to cater to my daughter when she was sick. There has been instances when I've had a endoscopic procedure already posted and the patient prepared, and morning I woke up to a sick daughter, and I had to actually give her medicine, leave her with my mother, and go cater the patient, like and then come back to her. But the point here for all working women out there, especially women mothers, I want to tell you is, when you're 100% where you are, like for example, I gave you a real example of what happened when my daughter was growing up. I think she was 4 or something. I can never forget this. She was 4 years old, and she had not eaten the previous day, and she had vomited even water the night. But I had to leave her, and I knew she was in the safer hands with my mother, and I had given the instructions. When you don't carry that guilt to the workplace and give 100% even at work, it actually, works out both the ways. When you come back home, you have the satisfaction that you have done the best at work, and the kid was being taken care of with the right person. Well, my mother fortunately was there to support me during those days. And the trick is, it's not just your parent or your grandparent or your spouse. Just delegate the right work to the right person when it's absolutely necessary, and don't carry that guilt, and make sure that you are catering to all the requirements. At least if not 100% at work during that time, give 100% at the time of the procedure. I'm just giving you the example that you can accommodate it to whatever scenario you want, but it is very much doable when you want to do it, when you have to do it, and rightfully so. You can't just let your patient hang around there when you have promised them a particular procedure for a particular reason. And you can't just hand it over to another person because they might hardly know about that patient, right? So you have to balance it in a way that you are giving your almost 100%. So practically very much possible in every scenario. You just have to think about it in the right frame of mind and not get overwhelmed with it.
Wonderful. Yes. So your passion for gastroenterology as well as your love for the patient is undeniable. What excites you most about the field today, your field? Is there any particular advancement in endoscopy that you think will redefine the patient care in the upcoming years?
Oh, yes, there are plenty actually. Just doing endoscopy and colonoscopy was a wow when I joined gastroenterology, but now that's become like very basic. I would rather want everybody above age of 40 years go through endoscopy and colonoscopy, just like you get your ultrasound of your abdomen. And even, in global level, there are guidelines coming up about it. Coming to advancements, it is absolutely fantastic. Even artificial intelligence is taking over it, where there are capsules instead of the enteroscopy. Forget about endoscopy and colonoscopy. In between, there is intestine, which is like meters of long, and capsule with camera, high definition, multiple camera. We just make the patient swallow it, and then that captures the tiniest of images without missing anything in those small intestines. Can you imagine that? And then when you come to uh, genetic sequencing, and even while you want to pinpoint what bacteria is overgrowing in your intestine, it's possible. Yeah. So these are like non-invasive. When it comes to invasive, again, when I'll give you another example. There is a bile duct which is 5 millimeter. Okay, less than 5 millimeter. It's a tube which is very fragile, very soft, which connects the liver to the small intestine. Can you imagine a stone so small stuck in that bile duct, which is a fragile tube, being removed endoscopically without any surgical incisions through the normal endoscopic, through the mouth into the stomach, and then the patient would have presented with fever, jaundice, vomiting, and almost sometimes even in ICU. And we do this procedure called ERCP, which is endoscopic retrograde cholangiopancreatography. and then we will be able to remove the stones stuck in that tiniest of bile duct, and very next day the patient can go back without surgical incisions and without any post operative care. So that's how advanced endoscopy is. And you must everybody knows about CT and MRI, right? And when they get into these scans, there are a few things which might be missed or might not be a very heavily defined. Then we have something called as endoscopic ultrasound, where the ultrasound probe is in the endoscope itself, and when we introduce that tube into the stomach and small intestine, it actually gives us magnified and high definition images of all the organs around it, which is much better than MRI and CT, I should say. So that's how highly advanced it is, and another amazing thing is no incision required. It's through your natural orifices.
Wow, that is very exciting developments in this field. So thanks so much for sharing that. Now let's talk more about the COVID-19 pandemic. So that period tested every medical professional in ways we never imagined. Dr. Prithvi, you were on the front lines during the COVID-19 pandemic while also navigating the personal challenge of being away from your children. What was the experience like? How did you find the strength to keep going?
Yes, that was a scary period, and many lives were lost, unfortunately. And the hardest period, I would say, because declaring deaths was not easy. And although we and it nothing was sure during that time. That is when you realize that you don't know what is going to happen tomorrow. Forget about flights being blocked, no international commute at all. And unfortunately, during that time, my kids were in India and I was in Dubai when this hit, and all of a sudden there's a news that there is no flights and we don't know when it's going to restart. Well, that was a complete panic mode where I had to take time to for that to sink in. But then the work got so busy, and it came to a period where wearing that those masks and those extra precautionary gowns and getting into, and in fact doing an endoscopy also on a COVID positive patient when it was an emergency, where it happened. And now to think about it, we feel like how were we able to do it to such a period where it tested all our strengths and might, and it took us to all different lengths. But fortunately, with God's grace, it was possible. And like I said, the worst was to stay away as a mother, and the video calls, and that was the only communication. And again, being a medical professional and getting back home to little ones would have been difficult, because I have seen firsthand where my colleagues, although it used to depend on the immunity, right? So, and we were in the probably we had a good immunity, and when we used to go home, there used to be extreme ages of people with us, be it our parents or the children. I'm talking about few of my colleagues, and they used to get affected, because how much ever you are careful, once you go home and then you completely clean yourself and change and go, somehow that virus was like crazy. And we had seen this also in the doctors' families, where they had to cater to not just patients in the hospital, but also the family members getting COVID. And thankfully, it's over and we have immunity. And then there was a confusion about immunization, should we or should we not? So it's all done. Yes.
Yes. Thank you so much. So, speaking of resilience, every leaders has their strengths, but also moments of weaknesses. What have been some of the toughest lessons that you've learned along the way?
Dealing with death and talking about it or explaining to the patients about cancer,
Mm-hmm.
giving that news when it comes positive. Yeah, these are the two things which are really difficult, and because it always comes with the question, at least for the family members when there is death, and for the patient himself or herself when there is a news of cancer that we have to break and probable cancer. So, why me? Why us comes in? And what would you say? You're just a human being. All you can do is explain to them what the diagnosis is. But if you're doing that, you're not a complete doctor. What I have realized through these 2 decades plus of my journey as a doctor, not just as a gastroenterologist, is you have to be human first, and you need to step into their shoes and understand how you would feel when you get this message to you. How would you want it given to you? And learning that was a process, and during that learning was tough. You had to break the news. At least when I was doing my MD and taking all the emergency calls of internal medicine, that's when you get all calls. Even I have catered in those 3 years to night calls of myocardial infarction, which is nothing but a heart attack or a stroke or a brain attack. So the when you're dealing with that, it has to be like few seconds. You need to know how to give CPR. You need to know identify, pinpoint what might be wrong, and within few seconds. And that just through that learning is what makes you what you are today. Not just catering that physical thing, but also the communication and the empathy that you have for the patients. And then again, when you go back home, leave it all behind. That's another tough thing because a patient is in ICU, very sick. You go back home, your daughter is enthusiastic to show the drawing that she's drawn. You can't just tell her, wait, I'm thinking something else. You need to change the mode immediately. So, that again. So, all these three, I should say.
Yes. And despite all the challenges and the tough lessons, your achievements speak for themselves. Let's talk about some of the milestones that define your journey. Your list of accolades is so impressive. UAE Woman Achievers Award, Golden Visa, Top Women Doctor UAE 2023, and many more. Which of these recognitions means the most to you and why?
All of it. I would be lying if I pinpoint one and say that was the most memorable. These are like cherishable moments, like be it UAE Women Achievers Award or the Leadership Award or the Top Doctor, Top Women Doctor of UAE, and many others, like you said. I think I've missed out a few, but it is so heartwarming to even remember all of it. You know what the best part? I have to tell you this. Every time I received an award, or every time I was featured in a magazine, or my article came up in very like Gulf News or a bigger news article that came up with the endoscopic procedure that was quick and life saving. The first thing that I would do was to share it with my children. I mean, not give them the finer details, and that smile. and that pride they would feel, it would definitely make my day as good as just going on the stage and receiving it. I would wait for the time to come back and tell them that.
Hmm.
So yeah, all of it. And golden visa was given by the UAE government right after the COVID period. They recognized the efforts that we had put as doctors, and they were actually gave that golden visa during that time, which is again a memorable thing. Yes.
Yeah. Wow, amazing. But awards aside, true leadership is about making a difference. So, what advice would you give to those looking to step into this leadership role in their own fields?
Leadership roles in any field. You
Yes,
don't have.
and especially, yeah.
Yes,
Sorry.
in medicine.
Mm.
See, all I give is don't wait for the title. Titles come along with it, probably later on. If you have that leadership qualities in you, you know it better than anybody else and put into practice. Right from day one of your work or your college days, like if you're making a difference around you, be it for three or a group of three people or 30 people, started from there. If you're guiding them in the right way and making sure people around you are happy, first of all, and then you are giving clear information of what you want. So, first is keep the atmosphere good, and second would be clarity in vision and thinking and putting it across in communication. These two things to begin with, and then everything else will fall into place, and titles will come later.
Wonderful. Before we wrap up, let's leave our listeners with something powerful. Please share your mantra for success and growth, Dr. Prithvi.
I would say without hard work, nothing comes easy. So, first, you decide what you want to do, and then you have a clarity in that, so that decision comes with clarity, right? And then you go ahead with perseverance and hard work. There's going to be up and down. Without that, no journey gets successful, and no journey which is successful stays a success. So through all these ups and downs, you go through your journey, and along with it, enjoy your journey. It's not the destination that matters, it's what you learn through the process, whatever you're doing, that makes you what you are.
Wonderful. Thank you, Dr. Prithvi, for such an insightful and inspiring conversation. Your journey is a testament to resilience, dedication, and passion. And I have no doubt that your story will motivate many. It's been such an honor to have you on the show. And for our
Thank
listeners, if
you.
you found this episode valuable, don't forget to subscribe and stay tuned for more inspiring stories. Until next time, take care.
Thank you very much. Lovely talking to you.
Yes, lovely talking to you as well. Hope you have a great day. Yeah.
You too. Bye bye.
Yes, thank you.